Good evening, everybody. I'm Betsy Fisher-Martin, the Executive Director of the Institute at University. We have some feedback coming in, so I'm not sure whose microphone that is. I'm going to close the mics. Laurie, I think it's yours. You might have two windows open. So let me see if you could get that while we continue. But welcome, everybody, to our virtual series, Women on Wednesdays. And whether you are watching on Crowdcast or Facebook Live, we are glad that you could join us this evening. To those of you new to one of our events, WPI is a nonprofit and nonpartisan institute in AU School Public Affairs that aims to close the gender gap in political leadership. And we offer academic and practical campaign training and facilitate research and discussions like this on women and politics and policy. So tonight we want to focus on three women who have been at the forefront of the fight to save lives from what is the #1 cause of preventable death in the U.S., and that's tobacco use. It's an epidemic that threatens the health, the lifespan, and the well-being of our next generation, and it's an epidemic that it has a staggering effect on women in particular. Lung cancer is the #1 cause of cancer death among women, and most cases of heart disease in women under 50 are attributable to smoking. At the center of the problem certainly lies the tobacco industry, and their decades-long history of marketing tobacco products to teens and to young adults is well documented. You don't have to look hard to see the deliberate marketing to women, images and messaging around slimness and sex appeal, as well as female empowerment and independence. So our three guests tonight actually do, though, define female empowerment. Dr. Donna Shalala has had a long career in both public service and higher education. Until just a few months ago, of course, she was a member of Congress from Florida, and she served as the Secretary of Health and Human Services in the Clinton administration. And she was also the president of the University of Miami from 2015 until 2017. Dr. Patrice Harris is with us. She is a physician and the immediate past president of the American Medical Association, where she was the first African-American woman in that role. And she continues her leadership role with the AMA, where she currently serves as a member of their board of trustees. And Laurie Rubiner is the executive vice president for domestic programs at the Campaign for Tobacco-Free Kids. It's quite a long title, Laurie. And that, of course, is a nonprofit education and advocacy organization leading the fight against tobacco. Laurie has had a long career in policymaking from her time as a key staffer on the Hill, and she's also an adjunct professor at Georgetown University Law Center. And finally, one more important woman I want to recognize, the powerful force behind the curtain of tonight's program is AU alum Martina Bradford of Palladian Hill Strategies, who is also a longtime leader in business law and public policy. And I know she's watching tonight, so we wanted to say thank you, Martina, for your help in bringing us all together for this important and timely discussion. Before we start, I want to let everybody know that we're going to save time for your questions. On the bottom of the screen, you'll notice a button that says Ask a Question, Please. Do so during the course of the discussion. You'll also be able to upvote questions from others that you are interested in. And if you miss any of the discussion, you want to share it with friends, the replay will be available at the same link you used to register. So welcome, everybody. Thanks so much for being here. Let's see, Laurie, I want to start with you. Let's see if your mic is not working. I think you might have two windows open, Laurie, on your computer. See if you have two windows for Crowdcast opening, and maybe that's better. Yeah, that's better, yay.
There we go.
So Laurie, let me ask you just to kick us off here, give us a sense of the newest threat that is out there, specifically vaping. You all at the Campaign for Tobacco-Free Kids have helped drive so much of the progress over the last 25 years, but you say that progress is now being threatened and vaping is really at the center of that problem. Can you give us a sense of that scope?
Yeah, I mean, it's a really, thank you, Betsy, and thank you, Dr. Shalala and Dr. Harris, and to Martina Bradshaw for bringing us all together. I'm really happy to be here tonight. So it's a really good question because for a while there, I think the Campaign for Tobacco-Free Kids thought we could shut our doors because we were really winning the campaign to end smoking, especially among kids. And then the tobacco companies also realized that, and they knew that they needed to find some new customers. And so they created this new thing called an e-cigarette, also known as vaping. A lot of people know it as a Juul cigarette. And it's sort of this small cartridge-based, some of them are tank-based cigarettes. And they are extremely powerful. They have a tremendous amount of nicotine. And most insidious, they deliver, they come in about 15,000 different flavors. And so they are very appealing to kids, the flavors. So it's the flavors that hook the kids, but it's the nicotine that addicts them. So they look like a very small thing, but they're extremely powerful. And each Juul cigarette, these small things, have the same amount of nicotine as an entire pack of 20 cigarettes. And so now we have about 3.5 million kids who otherwise probably would never have smoked, who are now addicted to these vaping cigarettes, e-cigarettes. And it's extremely difficult to quit once they are addicted to e-cigarettes. And so it's become a real epidemic. And this isn't my words. These are the words of the U.S. Surgeon General, who has called this an epidemic.
Dr. Harris, let me ask you, because I think many parents and even young people themselves are kind of shocked to learn how bad this vaping crisis is. Have we been duped into thinking that vaping is safe and a healthy alternative to like the traditional cigarette smoking?
Shocked is an appropriate word. Parents and teenagers that I've talked to are very surprised to hear what Laurie just told us, and that one of those cartridges is the same as smoking an entire pack of cigarettes. And also because it looks cool, it may appear harmless to teens. And many teens are shocked and angry, actually, because they didn't have the appropriate information and were not aware of the impact on their bodies, their brains. Actually, as a child and adolescent psychiatrist, I have elevated and amplified the impact of nicotine on the developing brain. Although folks of my age can still, make new memory and have new learnings, most of our, brain development occurs again up until the age of 25. And so we know that nicotine affects attention, learning, and memory. And, there has been some evidence to suggest that, and children, adolescents, and parents have heard that these Juul nicotine devices are harmless, right? They don't contain all of the other chemicals, and they are harmless. And so we certainly, through tonight and through the work of everyone on this panel, continue to raise the alarm. I know I do. And again, all of us on this panel do, so that parents and teens know that there are significant harmful effects on adolescent teens' brains. And I know we will chat about this earlier, but this is the last day of Women's History Month. And we also need to elevate these issues around the impact on women and women's health.
And why is it such a problem for women, and the impact is so significant?
Well, you note that tobacco is the leading preventable cause of death.
Yeah.
There are so many chemicals that folks don't even realize in smoke. But we also, and I think folks are pretty familiar with issues around lung disease and cancer, lung cancer, and maybe even cardiovascular disease. But most women I talk to are not aware of the harmful impacts on the reproductive system. Smoking can impact fertility. And once a woman is pregnant, of course, and has been able to conceive, smoking can lead to low birth weight babies. So there are a lot of harmful effects on the reproductive system that I just don't think women are aware of.
I want to just go back a little bit to the vaping. And Dr. Shalala, before I bring you in, I just want to play a advertisement, Laurie, that you all have out about the effects of vaping and this notion of the kind of flavored vaping that goes into this. It's just about a 30-second ad. Let me play that for everybody, and then we can discuss it on the other side.
Parents need help protecting their family's health. But before there was this, there was this. 3.6 million kids are using e-cigarettes.
Even during this pandemic, Big Tobacco is still targeting our kids, using fun flavors to hook them on e-cigarettes and endangering their lung health.
Menthol, mint, cotton candy, Captain Crunch, donuts?
It's hurting our kids. Families need help to stop Big Tobacco.
Protect our kids. Eliminate all flavored e-cigarettes.
And it's that the flavor that seems to be, the particular kind of marketing that is going on that's so impactful to young people. Dr. Shalala, let me ask you, because you were on the frontier of this fight here in Congress. You had an e-cigarette bill that you worked on getting passed in the House that would have raised the age from 18 to 21. But you faced some opposition even within your own party, and of course it did not pass through the Senate. Tell us about sort of that federal legislation and where we stand now on either banning the flavors. I remember Trump proposed such a thing, or raising the age. Where does the fight currently stand in terms of Congress?
Well, the House did pass a bill. Frank Pallone, the chairman of Energy and Commerce, and I introduced. And that bill not only raised the age, but it removed flavored tobacco, including menthol, which was very important because that targets the African-American community in particular. It also it prohibited most online sales of tobacco products. That was also significant. This is a hidden smoker. Kids can hide this in their desk because there isn't smoke. They can lean down and take a puff. So this, in many ways, is even more dangerous than cigarettes. So we've gone from beating down the tobacco industry to not target kids with cigarettes, and they pivoted and came up with a product that's even more more attractive to young people. So we did introduce major legislation. The Senate has not taken it up, in large part because the Republicans were not prepared to take it up. But it is possible for the new director of the Food and Drug Administration, when that person is appointed, to take very strong steps against e-cigarettes, including banning flavors. So I'm very hopeful about the Biden administration. Joe Biden knows this issue, as does the new Secretary of HHS. And I believe that we'll get some movement in the next 2 years, serious steps. But this hooking of kids is a long pattern of the tobacco industry, and we have to see it what it is. They don't have a market unless they hook kids. If we can prevent kids from starting to smoke before they're 18, they're not going to smoke later. So we just have to go after them. And my hope is the new FDA commissioner will take the next step. I have some hope for the Senate, but not a lot.
But did the FDA commissioner in the Trump administration originally propose that, and then somehow I think it was Senator Burr from North Carolina got involved, and then
they pulled it back.
Changed course. What happened there?
It died.
Yeah,
it died in the FDA, and it's not going to die under the new administration.
Yeah.
This is the next dangerous epidemic, but it's going on, and I think COVID has made it worse.
Yeah. I want to get to COVID in a second, but Laurie, I want to ask you first, what other kind of legislation are we seeing proposed at the state level to deal with this?
So we do work at the state level, and there are a number of states that are working to pass bans on all flavored products, including menthol cigarettes, which, as Dr. Shalala pointed out, are especially pernicious in the African American community. You know, 45,000 African Americans die every year from smoking related diseases. And again, this is another area where the tobacco companies have marketed in the most predatory way to the African American community. 85% of African Americans smoke menthol cigarettes. And that is not a coincidence. It's because the tobacco companies have marketed their products very heavily to the African American community. So it's very important. And I really applaud Dr. Shalala, because her legislation was a comprehensive bill that passed the House that included a ban on menthol cigarettes, which is really critically important. And Dr. Harris can tell you more about, she's been a really outspoken advocate and was tremendously helpful during the passage of Dr. Shalala's bill and making sure that that provision stayed in the bill. But there are a number of places around the country that have bills that are passed, including we've been working on a bill in California that passed, and the cigarette companies are challenging it, and it's going to a referendum. And we're working very hard to make sure that that we pass that referendum and the bill goes into effect.
Dr. Harris, can you talk about that? I mean, we have been having discussions more often now, certainly about the racial health disparities that exist. How does smoking and menthol play into that, and why are Black smokers so much more at risk from this?
You know, COVID-19 has certainly laid bare issues in our country regarding health inequities, and we've seen folks from communities of color share a disproportionate burden regarding deaths and hospitalization with COVID. But of course, these health inequities are not new. They existed pre-COVID, and there are a lot of issues around cancer rates and cardiovascular disease. And as we've seen the through line with smoking and tobacco. And yes, we found that 85% or so of African Americans, their choice is menthol cigarettes, and that's 3 times the rate as whites. And the menthol in cigarettes has been found to make it both easier to start smoking and harder to quit. And Laurie's talked about that aggressive marketing. You know, I'm old enough to remember the cool jazz fests that were predominantly African American artists. So, you know, the tobacco industry has certainly marketed in African American communities. And we know that, again, with the increased burden of disease already on African Americans, certainly this has proven to be a critical piece. And so I also applaud Dr. Shalala and was very happy to lend my personal support and support of the American Medical Association in banning all flavors. We should do all within our power. And you heard Laurie say we had made such great progress, particularly among adolescents, and we do not need to reverse the progress that we've made. And so absolutely we should be banning all flavors, including menthol.
So there's a debate even within the anti-tobacco community that some folks saying, and I know someone's even asked a question about this, that e-cigarettes are indeed much less dangerous than smoking, and vaping can be an off-ramp, so to speak, for somebody that's trying to stop smoking, because the vaping at least gives them some sort of nicotine fix. And the criticism is, does the opposition to e-cigarettes, does this come at the expense of curbing the use of smoked tobacco? Let me get, you know, each of your thoughts on that, you know, in terms of, are we, you know, are we harming ourselves in the sense that we're going to prevent people from using vaping as a way to actually stop smoking? Laurie, let me start with you on that.
Well, no, not a single e-cigarette company has ever applied to the FDA as a cessation device. So I'll start with that. So if they actually are a cessation device, they should apply to the FDA to be a cessation device. So that's
like
number one.
Nicotine patch kind of thing, right?
Correct, exactly. So there's no evidence that they are actually a cessation device, but more importantly, it's hard for me just as a reasonable person to believe that flavors like Captain Crunch and unicorn poop are designed for adults, just as a reasonable adult. And the evidence shows that it's the kids who are using those flavors, and they are targeting and marketing them to kids. And we just did a very interesting study that showed that a disproportionate number of the vape shops are located near schools, middle schools and high schools, and they're not supposed to be selling to those kids. Then why are they locating near schools? So again, I just go back to, if they are meant to be a cessation device, then go through the process of applying to the FDA as a cessation device. And it's not as though we're taking the devices away entirely. People can still use an e-cigarette. They're just not going to have unicorn poop and Captain Crunch.
Dr. Harris, from a medical standpoint, are e-cigarettes, do they help people get off? Are they an off-ramp for smoking? What is, just medically speaking, what is your sense of that?
I and public health professionals and scientists have been talking about the need for us to follow the science and the data over this last year. I have said that so many times I cannot count. And here's another opportunity that we must do that. The physician community would welcome another tool in the toolbox to help people quit smoking. That is critical. We've already explained and highlighted the health harms. And so we would welcome that opportunity, but we really do need the science. And yes, if you are clear or think that you are a very good opportunity or choice to help with smoking cessation, do the study, apply to the FDA so that we can have the data to make these decisions and make these recommendations to our patients.
Dr. Shalala, let me ask you, because Dr. Harris mentioned earlier sort of the marketing toward the African-American community and co-sponsoring, cool jazz, etc. I want to ask you about women. And I know Lucy mentioned this in the chat, and we all remember that the slogan, you've come a long way, baby, right? Virginia Slims. And sort of capitalizing on that, the cultural moment of, women's rights advocates in the 60s and 70s. What do we see as sort of, how the tobacco industry does target women in particular, and this notion of, being glamorous or sexy, or even about, women's empowerment?
Well, the tobacco industry is very clever. The Marlboro Man to target men, the cowboy, and tying themselves to the women's movement. And the second wave of the women's movement by sponsoring the big women's tennis tournaments, for example, with Virginia Slims. Let me go back to the issue of whether you can use this for cessation, though.
Yeah.
Because I agree that there's no evidence. I was a smoker. It is very difficult to stop smoking. Maybe one of the most difficult things I've ever done in my life. I smoked for 10 years. I started smoking as a young journalist in college because everybody was smoking at our student newspaper. And 10 years later, I just had to stop. And it was extremely difficult. There are a lot more ways to stop now. We have a toolbox. Institutions provide access to that for their employees. Doctors in our health systems can talk to people about how they can stop and what they can use to stop. There are different ways to stop, but e-cigarettes is not one of them. And these tobacco companies are targeting women, they're targeting children, and the targeting of children is to create a market of the future. We have to be very clear about that. That's what they're doing. If they hook the kids early, they're going to have them for a very long period of time, and we've got to stop them from targeting children. We, in the 1990s, with the campaign for tobacco-free kids and into the 20th century, we actually drove down the number of kids that started to smoke.
Right.
Worked. The campaigns worked to stop kids from smoking. and we dried up some of the U.S. market at the same time. But then they pivoted and went to e-cigarettes, and this is unacceptable.
Laurie,
and unacceptable to every family in America.
I guess, Laurie, let me ask you if we sort of missed this shift coming, because it seems like, as Dr. Shalala said, things were getting better, and then all of a sudden here came e-cigarettes, and then it seemed to go from 0 to 60 very quickly. Did we miss? Maybe we lost your video. Well, Dr. Harris, let me ask you, just as from the medical community, did we miss that jump from e-cigarettes coming along like they did?
It was quite a 0 to 60 moment for me. And, I work with children and adolescents. And so I pride myself on, keeping, an ear to the ground and knowing what's going on. But I can tell you that it seemed like overnight, we had this epidemic, and of course, we're seeing all of the health harms, and we were seeing adolescents in ICUs and, all of those issues. So clearly it did not happen overnight. But I will tell you that I think that it happened very quickly with our adolescents. No question about that.
I know we mentioned COVID a little earlier, and I want to spend a little bit of time talking about that. Certainly it's sort of the perfect storm when it comes to smoking. You've got addiction, you've got quarantine, you've got anxiety, and you've also got people, frankly, who are working from home, whereas versus the office where smoking is not allowed. What has been the impact, or what have we seen over the last year, just in terms of tobacco use and cigarette smoking in particular? Laurie, are you back with us?
I'm here. So it's one of the problems. So it's a sort of blessing and a curse. A lot of the vaping took place in schools. So teachers knew, or kind of knew or didn't know, because vaping, unlike when we were kids and you smoked in school, you could smell it. You could smell it on your clothes. You had to hide. You had to do it outside.
Bathroom.
Right, exactly. Right. And as Dr. Shalala said, one of the things about vaping is you don't smell it. And it's so invisible that there's even a product that's a hoodie that you can vape from the strings on the hoodie. That's how invisible it is. So once kids went home, we didn't, we kind of, like a lot of things that we lost track of when kids weren't in school, we lost track of how many kids were vaping because parents weren't sure. They didn't know. And so one of the things that we did at the campaign was we put out some resources, and it's on our website, of what parents can look for to see, to figure out if their kids are vaping. There is anecdotal evidence now coming out that smoking and vaping increased during the pandemic. And we know that from sales data. Yeah. And it's not surprising because those are tools of anxiety, right? So of course, people who are anxious are probably going to vape and smoke more. But I think we're going to probably have to wait a little bit until we find out. But we very quickly, like Dr. Harris, quickly said, wait a minute, there is a link between COVID and smoking and vaping. And the last thing you want to be doing is smoking or vaping during an epidemic that's a respiratory illness. So we did get out very quickly, as did some of our public health partners, with public health messages that please do not smoke or vape during this respiratory pandemic.
Yeah, I mean, that's a good point, Dr. Harris, too, about, the impacts of COVID we know are exacerbated by people that are smokers.
I did an op-ed, co-authored an op-ed with Dr. Sally Goza, who was at the time president of the American Academy of Pediatrics, and the title of that op-ed was "Who Has Eyes on the Children?" And so I think you're right. Yes, they are no longer in school, but now they are, at home. And so we don't have the data. We will certainly have to make a commitment to get the data. As I've often said, the plural of anecdote is not data, but there is some information again regarding the increased use. We know that this has been a very difficult time, a lot of disruption, a lot of loss, loneliness, frustration. And so, we've had to call on our typical coping measures, but at times folks have called on coping measures that have not been so healthy. So we've seen reports of increased number of overdoses, right? Increased use of alcohol and increased use of vaping and smoking. And so we will certainly have to make sure we keep our eyes on the children and on the data, and just continue this campaign of making sure that our young folks particularly are educated about the harmful effects. We have to make sure that women are educated about the full range of harmful effects, because again, I don't think even most of my friends are unaware of the issues around fertility and low birth weight babies, difficulty conceiving. And so we need to make sure we continue to educate folks and follow the science and the data, and require that if people make claims about a particular product, that those claims should be backed by evidence and the science.
Dr. Shalala, do you want to weigh in on that?
Yeah, the way I convinced the Democratic Caucus to vote for the bill is I took all these things and showed them what kids could use. Mm-hmm. Most of them were unaware. The hoodie was a big hit in the Democratic Caucus. People just gasped at the fact that you could put on a hoodie and take the string and take a puff. So we took a lot of different vaping instruments and showed the leadership and all of the Democrats exactly mm-hmm. what was going on. But it did not catch us by surprise. We saw it coming. And particularly as the large tobacco companies started to buy these vaping companies, you began to see a different level of marketing at the same time. But we have an epidemic. We have an epidemic that's going to cut short the lives of a whole generation of young people. Mm-hmm. And we just have to go back at it. And my hope is that the Biden administration will do exactly that.
There was another, in terms of the Democratic caucus, there was some opposition, I guess, within Democrats. And I remember the ACLU getting involved and calling the bill a criminalization measure rather than a public health one. What was your pushback to that?
Well, it was really, we were very careful about the language. We actually worked with the campaign. We were very careful with the language that no kid was going to be arrested mm-hmm. because they were vaping. Mm-hmm. We couldn't be more careful. We had a lot of help from some very distinguished African-American legislators. Karen mm-hmm. Bass of California was very articulate within the Black Caucus and within the Democratic Caucus about how important this was to every community. But we snuffed the issue of criminalization very quickly by showing people the language and by the chairs and the important people in our Judiciary Committee saying, no, that is not what this language says. It was carefully drafted.
And the Black Caucus overwhelmingly supported the bill. I think it was 32 members of the Black Caucus supported it. So, ultimately, as did the majority of the Black medical community. So,
and that was an important marker, I have to say. Mm-hmm. And I think sometimes we should make sure we are having these conversations explicitly. But that was an important marker for leadership at the federal level. And I know that through the AMA and the Federation, we made sure that any legislation at the state level took that into account, because we certainly did not want to criminalize those who were, quite frankly, addicted. I mean, we've been through that before, just quickly around the opioids and mm-hmm. heroin. And in the 70s and the 80s, when most folks who were addicted to opioids were Black and brown. In the Black and brown community, our society's response was criminalizing the user, right? So, and
Right.
then when we had the opioids and prescriptions, and most of the folks affected were, middle class and upper middle class white families, we decided that our society decided that treatment was the intervention. And by the way, as a psychiatrist and someone who's worked in addiction, I'm very glad that we are recognizing that, but we cannot, go without explicitly stating the history here. And so again, that federal legislation and the explicit conversations around that were critical. And I know that from the AMA and federation level, we made sure that was clear for any state bills that were being proposed.
Mm-hmm. We have a couple of questions in the audience, and if anybody else has questions, feel free to type that in. But let me start with Isabel's question. She said, we learned in last month's Women on Wednesday event on the pandemic politics that a majority of mothers are the primary person responsible for making health decisions for their families. Are you seeing a similar pattern as far as who is addressing smoking at the family unit level?
I don't know the answer to that question.
The first part is certainly true. We may not know, but I would imagine so. Here's my guess that is true. I heard someone, this is not original for me, but they said women are the chief medical officers of families, right?
That's true.
Because they make up, most of the healthcare decisions around everyone in the family. I will say this, as we are negotiating and navigating COVID, and we've seen disproportionate impact on women, especially those women on the front line, those essential workers. First of all, I would say that we need to make sure that we are taking care of ourselves as women, because for more often than not, we, again, as chief medical officers of families, make sure everyone else is taken care of and not ourselves. But my guess is that is likely true.
Yes.
Sorry, go ahead,
Dr.
Dr.
Word about grandmothers too.
Yeah.
We have different configurations of families that are responsible for children in this country. Mm-hmm. And grandmothers are just as important as we're talking about women and the role of women.
I also, I think it's probably true. We work with a group called PAVE, which is Parents Against Vaping. I can't remember what the E stands for, but and they do a lot of great work on behalf of many of them have kids who were vapors, and they've helped them quit. And so far, I don't know of any men that are part of the Parents Against Vaping. So I think it bears out that it's all women who are leading that organization. So I think it continues to be the mothers who are the CFOs or the CEOs of the medical community for their families.
Well, Laurie, you mentioned that the toolkit that you guys have in terms of trying to help parents kind of figure out what's going on, because as you all mentioned, the vaping is not the same as cigarette smoking, where you can tell, who's been smoking in the room here, right?
Right.
But what are some of the things that are in that toolkit to help parents identify where they're high school or maybe vaping and they don't know about it?
Well, I mean, it's a lot of it is just kind of common sense, right? So it's and there are things that probably Dr. Harris would know as a psychiatrist. It's if your kids are isolating, if they're stressed, if they're those kinds of things, if they're isolating in their room, if they're buying things, you might want to look and see if they're buying things online. Those are the kinds of things you want to just look and see and be attentive to. If there's any health changes in your kids, because vaping, certainly the high doses of nicotine can cause all kinds of changes to a child's health. Mm-hmm. So looking for those kinds of signs, and just being attentive, especially now when kids are home so much, just looking for those kinds of things.
Here's one more question from Isabel. She's on a roll here. This is for you, Dr. Harris. Can you speak specifically to the relationship between children and adolescents' incomplete brain development and addiction, and how that makes them more or less susceptible to becoming addicted to vaping in particular?
Well, I will say this, as the brain develops, and I think everyone is likely aware that it is much easier to learn to play the piano, the violin, or any new skill when you're younger, right? Because the brain, again, is developing so much and making these connections early on. Again, the last part of the brain, all parents know this intuitively, to develop is the frontal lobe of the brain, which is the part of the brain that's of reasoning and thinking and cognition. But we know that, again, nicotine impacts learning, attention, and memory. And certainly the more, and the brain is very plastic, but as the brain is developing, if you are, interfering with those connections regarding memory and learning and attention, certainly those can have lifelong impact. So we certainly need to be aware of that. And we mentioned earlier that, it could increase anxiety. And I can tell you that pre-pandemic, we've seen increase in anxiety, increase in sad moods, depressed moods, again, loneliness and isolation since the pandemic. But pre-pandemic, we were seeing increased levels of anxiety and depression in our teens. So, the key is, and I think there are opportunities, and not that this is easy, I know, just as Dr. Shalala mentioned, quitting smoking is very hard. I always want to make sure we recognize that, because it is. No one is saying that it isn't. It's not always easy to keep those lines of communication open to our adolescents, particularly. But, do that, talk to them, ask them what they know, who's doing this, what information do they need from you? And, it's not about lecturing. I think we know that kind of this is your brain on drugs didn't work. But it's, again, accurate information, the facts. This is the impact on your health, and keeping those lines of communication open is critical.
Laurie, we had during the tobacco campaigns, we talked to young girls about the effect on their skin of nicotine.
Interesting.
Another one that I learned about is the effect on your teeth and your mouth, which I just learned a lot about that from the dentist, and I won't go into it because it's almost dinner time, but you can go on the American Dental Association and get your kids to go on it, because I guarantee you that will scare them away from ever vaping.
That's a good point. We have a question from Sydney about the messaging specifically targeting women. I know we mentioned sort of the Virginia Slims component, but I guess what kind of advertising do we see now? And then also, I guess I would add to that, what do we see just in the entertainment industry at large, how women in tobacco are being portrayed, and has that gotten better? I mean, I would think anecdotally, yes, but I'm curious of your thoughts on whether that's kind of that's improved at all in the world of entertainment and movies and that kind of thing.
Well, I think it has improved because we went after the entertainment industry. They have kids,
right?
And we talked to them about it. But the Europeans are still smoking like mad in European movies. And whether it's vaping or cigarettes, I'm seeing a lot more in foreign films than I am in our own films in this country. But we've been working with that industry for a very long time, including the shows that young people watch.
Yeah. And does smoking in a movie, does that trigger a ratings impact? Does that trigger an R rating? Or what's the policy on that?
Yeah, Laurie?
Yes, it does. So that's one of the great things that we were able to accomplish here in the United States, is that smoking does trigger higher ratings. I'm not exactly sure. I think it might be an R rating, but you'll see when you go to a movie now, it'll say, it's an R rating for language, violence, smoking. So that's here, but Dr. Shalala is correct. We haven't made that headway overseas, and so you still. Being home during the pandemic, I've watched a lot of European and there's a lot of smoking going on in Europe still, in the movies and on TV.
And with my early admonition around anecdotes, but it seems to be, and maybe it's what I've been watching too during this pandemic, but I've been seeing more smoking a lot in shows and films. So I will continue to, take a look at that. And again, we certainly want to be fair and make sure we have the data on that. But anecdotally, I appear to see more smoking more in movies.
And is it still, in terms of women, is it sort of the glamorized smoking that's going on?
I don't think I know. I'm not equipped to answer that question. I will say the slick marketing of some of the vaping products. Some of them are very slick and sleek, that can appeal to, really to probably both men and women, but some of them you take them out and they look pretty, they look pretty great. They've obviously, the tobacco companies are obviously doing their market research, and they come in all these different colors. They're very cool looking. They know what they're doing.
And it's a lot of social media.
Oh yeah.
It's a lot of social media.
Yeah. How is that a good point, Dr. Shalala? How has social media impacted all of this?
Most of the advertising I'm seeing is on social media.
Pop-ups, okay.
And films, and short films and things like that.
Interesting. Here's a question from Caroline. She says, since smoking is often a tool to ease anxiety, are there efforts to strengthen mental health resources and programming as a way to help people develop healthier coping mechanisms and lower smoking rates? I know Dr. Harris, you talked a little bit about that, but is there anything you want to add to that in terms of other mental health resources for people during sort of this time of high anxiety?
Well, the other, or maybe I should say another, issue that has been elevated during COVID is the lack of a mental health infrastructure. Mental health has been underfunded for decades. And so we entered the pandemic really without a very good, solid infrastructure for mental health on so many levels. So I do not believe there is just an explicit focus on mental health resources to reduce anxiety related to smoking and vaping, but there is an explicit effort to increase resources for mental health services just in general for so many reasons, and to do so regarding integrated mental health, integrating mental health into overall health. I know the AMA has worked and developed resources for our primary care colleagues to integrate these resources. And I know we are working on models where there's consultative models with psychiatrists. I am a child psychiatrist, and I know that we are shortage specialty. So I know that there has been increased emphasis, and I hope that follows with resources. I am certainly not one to believe that you could just throw money at a problem, but there are things that just require resources. And Dr. Shalala may know a little bit more about this, but I saw something the other day about a new bipartisan committee that plans to focus on mental health.
Yeah. And let me add that if you want to see a place that has expanded their resources for mental health, look at the colleges and universities in this country. They're all building extensive infrastructures. And I don't know the extent to which telemedicine has helped psychiatry, but maybe Dr. Harris can talk a little about that, because the expansion of telehealth, the previous administration, and finally settling on some reimbursement has led to the specialties actually doing more. And I don't know to the extent to which in your profession that has been helpful.
Extremely helpful. In fact, many of us have been advocating to expand and support telepsychiatry. And I was using telepsychiatry some, again, pre-pandemic, but clearly telehealth was accelerated exponentially during COVID. But what was also important, and the previous administration did, working with, healthcare stakeholders and physicians, made sure that there was equitable payment. Because I can tell you, even for me, as I saw patients pre-pandemic, the reimbursement was less, for telehealth. And also another issue, and again, gets into the broader issue around technology, is not everyone had broadband. We saw that
Right.
an issue. So as we were rapidly working across all domains to reduce barriers to adoption of telehealth, and payment is one, but also what's allowed. And the previous administration did allow, again, during this pandemic, the use of the telephone, because not everyone was tech savvy, had a internet access, broadband plan. And so I think, and so many of these, barriers we should make sure stay eliminated post pandemic, and continue to collect the data. But I do know that we need more data, but there's been some data to show that psychiatry certainly expands access. Now, it is not a one size fits all. I can tell you some of my patients love it. And some of my patients said, no, wait, Dr. Harris, still want to see you in person. Don't like it. So we should not look at this as a one size fits all approach, but it's right patient, right time.
Well, I want to let everybody know before we go of a couple of our upcoming Women on Wednesdays before we close out this really substantive discussion that we've been able to have this evening. On April 21st, let everybody know that we are going to have a discussion about women in film. This is going to tie into the Academy Awards that are that week. So we're going to have Robin Bronk, who heads the Creative Coalition, which is an organization made up of artists, and then also Alicia Reiner, who some of you may recognize if you are Orange is the New Black fans. Actress. She will be with us to discuss that issue as well. And then coming up in May, we're going to talk about Nancy Reagan, a new book out about her by journalist Karen Tumulty. That'll be on May 12th. And then we're going to have a discussion with former Congresswoman, former colleague of Dr. Shalala, Jane Harmon, who is out with a new book about national security. And we want to talk to her about that, and also the role of women in national security as well. So we hope that you all can join us for those discussions as well. And so as we close out tonight, I just want to thank our panel so much for their time, Dr. Shalala, Dr. Harris, Laurie Rubiner, for a substantive discussion. And once again, thank you to Martina Bradford for all of her help in organizing tonight, and Gregory Spence as well, and Laurie, all the terrific folks you have at the campaign for their resources and putting tonight together as well. So thanks for watching, everybody, and have a safe rest of the week. And there's a cameo doggy.
Oh yeah, this is my new rescue dog, and his name is Fauci.
I love it. That's perfect. All right, that's a great way to end it.
Up on my lap. He wanted to get into it. He's a publicity hound.
All right, great. Well, thanks, everybody.
Thanks, everybody.
Good night. Thank you.
Good night.